we're going to be doing from Holtorf Medical Group. And this is going to be all about innovative ways to help you lose weight. We see patients every day with incredible frustration in this area. I think it's the most difficult thing that people deal with over their lifetime, most people on average. And so it's really exciting to help people actually achieve success in this area. For those of you who don't know me, I'm Dr. Elizabeth Lyster, or I go by Dr. Liz as well. And my background is actually in OBGYN. However, I stopped doing OB, and then the surgeries went by the wayside. I was a surgeon before, and my practice came down to what I enjoy doing the most, which was helping women with hormone balancing and weight loss. I became a specialist with that. I knew about Dr. Holtorf for quite a few years, and the opportunity came up to work for Holtorf Medical Group, and it was very exciting. And over the last few years as well, even before I came to work for Dr. Holtorf, I was pursuing advanced training in hormone therapies for men as well as for women. So it's a real honor, and I love my work. So that's a little bit professional background. I have two boys, two sons. They are 11 and 13 years old, and I have had my own challenges with my weight, and so developed a personal interest in that sometime after turning 40 years old. And sorry, I don't have my before and after pictures for everybody tonight, but I definitely had a personal stake in this topic as well. Now, I want everyone who's listening to know that tonight's webinar is action-oriented. I'm hoping that you'll be inspired to take up some type of action, especially if you have given up in this area. As it says on the title slide, you've tried everything. So I don't want us to get too caught up in the technicalities of the various things that we're going to talk about. What I really hope to do is give you some information and really have you realize how many different things there are out there to try to assist with the challenge of weight loss. Okay, so we are going to have a little bit of statistics and a lot of good information for you, but hopefully if you have any questions, we'll take questions at the end. Jenny will moderate that process. It will be through texting on a chat box on your computer, and so that'll be great. And so we'll go ahead and get started. First, I'll figure out which of my buttons on my computer. Clicking is what does it. Okay. All right. So we're going to cover a few different topics this evening, and we're going to talk about hormone optimizing. We're going to talk briefly about that. We're going to talk about thyroid, dysfunctional set point. I'll explain what that means in a little bit. Leptin resistance, and state-of-the-art treatments using all kinds of various pharmaceutical products as well as dietary supplements. So we're really going to cover a broad range of things this evening. Just to let you know what we do that's really, I think, unique and innovative, the Healthspan Medical Group, we actually specialize in innovative treatments, and we integrate lots of different approaches, pharmaceutical, bioidentical hormones, nutraceuticals, to help people with chronic illness. And we use evidence-based medicine and studies that back up a lot of the modalities that we do to assist with complex and poorly understood illnesses such as fibromyalgia, chronic fatigue syndrome, metabolic dysfunction, which is really what we're focusing on tonight, and age-related hormone disease. So challenging cases are our specialty, and people come from all over the world to the various centers in the United States. These are our lovely shining faces of the Holtorf Medical Group doctors. And across the top and the bottom rows are the doctors. This is Dr. Holtorf up here. This is myself down here. And in the middle are our nurse practitioners who are located in the Torrance office. And so we are very honored to work for our patients and help them feel better after they have oftentimes seen many other people not really feeling better and achieving weight loss. So just a little bit of philosophy background to kind of get you a little context of where we're coming from, the Holtorf doctors and the nurse practitioners. This is showing what is the normal health span curve. And going up and down is 100% of feeling our very best health up in the top of the curve. And so we're born, and hopefully in most cases we grow to achieve our best health and we feel our most vitality. And then we've got our 20s, 30s, and then cross the line at 40 and things start to drop off. And then unfortunately a lot of us spend our last few years of life not well. This is going down from optimal health down to suboptimal, chronic illness, and then severely ill. So unfortunately what a lot of our current healthcare modalities do with medications and treating symptoms is it extends how long we can live while we're chronically ill. So while that's, of course, on the one hand, a good thing to live longer, not if we don't have the vitality and really feel well as we want to. So what we're doing is trying to square off this curve, okay, have us spend more time at a high level of health and wellness and have the drop-off towards the end of our life really be over a shorter time span and at a later age. This graph goes further out in age, and really that we could make that curve go even further out there. All right, so what do we have now in the United States? We have a big problem, and it's spreading. We're exporting it to the rest of the world. Okay, so at least this number of Americans obese or overweight, 200 million Americans. That's including the overweight category. And this is even an old number. It's probably higher than this at this point, but at least 77 million Americans on some kind of diet. So what we're looking at here is trends in obesity in the United States. And I put the word obesity in quotes because, you know, it's a very technical, it's a medical term, but no matter what we call it, what we see is people, unfortunately, getting heavier and heavier. So back in 1990, we see the states that had data collection on people that were overweight, or actually this is not looking at overweight, this is only looking at obesity. And as we see here, there's light blue and dark blue. Over here it gets darker blue, and if you look across the bottom, what you'll see is that that's an increasing percentage of the population that is obese. And so the last image I have for you here is 2006, but you can probably guess that at this point in time, there are, of course, no blue states left, and there's no peach states left either. They're all at least 25% or over 30% of the sampling reporting obesity. So this is the shape of things as they are. So, you know, for us human beings as a species, we have succeeded as a species because our bodies are designed to withstand starvation, okay? And we are designed to hold on to calories. Our bodies are designed that way. It is not our imagination. I often say that women's bodies are even more designed this way. Sometimes I use a quip and I say that men's bodies are designed to chase the tiger and women's bodies are designed to make the babies. So this can even be more of a challenge. Oftentimes it can be more of a challenge even for women than for men. But over time, our energy expenditure has gone down and our caloric intake has increased. So unfortunately, this is not a good direction what we want to see over here. Another thing that happens as we get older is a drop-off in hormone levels. And so this is not for you to worry too much about the details of these hormones. We'll mention them again briefly in a moment. But basically a lot of our important steroid hormones, the sex-related hormones, decline. What we see in the middle here, testosterone, growth hormone, DHEA, and pregnenolone, which are adrenal-related, drop off gradually over the course of our life. Progesterone in women is dropping off, takes a big drop off in our 40s. Estrogen does this crazy up and down as women go through menopause. And down at the bottom is melatonin, which affects our sleep. It's a natural hormone. So it's normal and quote-unquote normal and natural for our sleep to decline in quality, and this is essential to weight loss. So up here at the top it says which hormones need replacing. That's really more of a philosophical question because for us to stay alive, none of these hormones require replacing. However, the symptoms that arise and the quality of life decrease that occurs with the declining levels of hormones can be very, very significant. So here we see thyroid, testosterone, not just in men but in women as well, growth hormone, and we'll talk about several of these in a little while. DHEA, pregnenolone, as I mentioned, are from the adrenal glands. Melatonin is secreted by a gland in the brain to help us sleep, and estrogen and progesterone in women. So what happens when people go to their doctors and they say, I cannot lose weight, I think it could be my thyroid? Well, a lot, if not just about every single one of the patients that we see here in our offices will report that they had testing done and they were told that their tests were, quote-unquote, normal. So what does normal mean? Okay, here she is. She's lying on the ground. She can't get up. She feels exhausted. And the doctor says, good news, your test indicates that you're in the normal range. And she's barely inside the range, right at the bottom here. Okay, so I love this cartoon. It's one of my favorites. So what this actually means is that the reference range, or the normal range, as it's mistakenly called, is only a statistical calculation. It means that 95% of people who had that test performed had results that fell in that range. That is all it means. So what we see here is a perfect example of a thyroid test where we're given, this is a very common reference range from one of the labs that we use primarily, 2.3 up to 4.2, and normal, quote unquote, falls in between and abnormal falls outside. But let's now talk about what's optimal and what's below optimal. So optimal is from about here and or higher, okay? And below that, so even if someone falls in down here, that is not optimal levels. And bringing the levels up to optimal can often, very, very often, clear up symptoms and actually prevent disease as well. Now let's see what this has to do with weight in particular. Okay, that's what we were just saying there. Okay. Alrighty, so we're going to look at a chart, a graph actually, a drawing that is on the holtorfmed.com website. And what we're seeing here is the thyroid gland makes the inactive hormone, which is T4, which has to convert over to T3. And T3 is what is active in our bodies. And if we don't have good conversion occurring to the active form, we can have all kinds of symptoms. And this is just some of the symptoms. This is a whole slide. I'm going to give you a whole long list here that just keeps going and going. People don't feel well, their mood is poor, their gut doesn't function well, their muscles ache, motivation, memory, mental function is affected, they feel freezing cold, headaches, all these kinds of things, menstrual abnormalities, all kinds of things. Hair, skin, and nails are affected, and it's just a very long list, and this is not everything on that list. Unfortunately, so as we said, the traditional way of evaluating thyroid is that it is only looking at the TSH. Okay, so the TSH is above a certain level, usually above 4, is considered to be a slightly elevated TSH. And this misses over 80% of people who have suboptimal thyroid function. So people can have many of those symptoms, but 9 out of 10 doctors won't treat because they're only looking at the TSH. Now, this is showing the same drawing, but what I want you to picture is what's happening is the T4, instead of going in the right direction, is going over to reverse T3. Now, reverse T3 has been taught to doctors and thought to be inactive. However, it's actually not inactive at all. It decreases the cellular energy production, and it blocks the effect of the T3. So if you have a T3, a free T3 level, that's okay, but we don't check the reverse T3, then we are going to not realize that we are dealing with a subclinical low thyroid condition. Subclinical meaning it's not showing up on the usual tests. So what we see, this reverse T3 problem is very significant with chronic dieting. So those of you who have used various methods, diets, to either no success or an immediate yo-yo effect where your weight just bounces right back, that can be because calorie restriction causes our bodies to shut down the metabolism. And the way it does it is by making more reverse T3. So I don't want to get too complicated with that, but hopefully the only thing I want you to keep in mind is the very important role of reverse T3 in the lack of success that many, many people have with weight loss. Okay, so another thing about reverse T3 is that studies have shown that it only takes about 4 weeks of dieting to get this process to kick in. Okay, so that kind of, it's an adaptation to calorie restriction that our bodies used to survive. The problem is that now we've got plenty of calories to survive. There we go. So excessive dieting, instead of the T4 going to the active T3, the body clamps down on the metabolism and puts it into reverse T3 instead of the active form. So we have the opposite problem of other parts of the world. So this mom on the left says, finish your dessert. There's kids starving in China, as we say to our kids sometimes. And then the mom in China says to her kids, don't eat the whole cake. There are children with diabetes in America. So, it's one of these things that is intended to be a little comic relief, but it's a little bit sad that we've headed so far in this direction. Alrighty, so we're going to spend a little bit of time on some of the things on this list, but basically I want you to just be aware that there are all these different modalities. I'm going to go into a little bit of detail on some of them. We will talk about naltrexone. Phentermine, phendimetrazine are stimulant and appetite suppressants. We will talk about HCG. Ally is, it kind of came and went in popularity, blocks the absorption of fat. Serotonin we'll talk about briefly. Byetta, Simlin, Victoza, we'll talk about those as well. Phentermine plus topiramate is another possible combination. Again, we're talking about innovative ways to use existing medications that have been shown to have weight loss as a side effect. And then naltrexone plus Wellbutrin we'll take a look at. Okay, and then, as I said, we're going to go through most of these on this list in the next few slides. And if anyone has particular questions, you can be sure to text us those at the end of our presentation today. Let's talk about leptin as a whole category of information. This is one of the latest areas of research related to weight and weight loss. Leptin is a hormone secreted by the gut. It's a major regulator of body weight and metabolism. And when the signaling to the brain is dysfunctional and not working correctly, it can result in a vicious cycle that keeps people from losing weight. Another way we refer to this is leptin resistance. We'll talk a little more about that in a moment. So normally what happens is when we gain weight, normally leptin is secreted and it tells the body to stop storing fat. So it's normally secreted to keep the body in a balance so we don't gain excessive amounts of weight. So the leptin stimulates the metabolism. It turns the furnace back up to burn calories, stimulate the metabolism, lower the appetite, and burn the fat. So enough fat, leptin is secreted, burn the fat. However, there's a condition called leptin resistance. Okay? So what we see when we actually measure a leptin level in individuals who are overweight is that we find a leptin level over 12, and the highest I've seen so far in one of my patients was up to 60. And this is reflecting leptin resistance. And what does that mean? Is that the leptin isn't producing its usual effects of weight loss. And the worse the problem is for the person, the more overweight or obese they are, or the more difficulty they're having losing weight, we see the leptin level go higher and higher. So the body thinks that it's starving. Okay, so the signaling is off. So the appetite stays high, the metabolism stays low, thyroid secretion goes down, and in fact it's the opposite of what ought to be happening. The signal is being given to actually store fat even when there is already more than enough for survival. So we have a category of medications now that are leptin sensitizers. One of them is called Byetta. The next three slides are actually diabetic medications. They are FDA approved for diabetes, and they have weight loss as a very good side effect. And as you probably know, losing weight is an excellent way to actually reverse the process of diabetes and or to prevent getting diabetes in the first place. So unfortunately, the way our health insurance system as it exists operates is that it's covered on insurance when people are already diabetic. So sometimes, actually in a lot of cases, we are able to have our patients get these medications covered by their insurance and are able to achieve weight loss using these, especially when we know leptin resistance is part of the problem. So Byetta and Simlin, these are studies showing placebo at the top and the study medication showing a much greater effect, decrease in weight over time. And these injections are twice a day, and we teach our patients to self-inject when they're here in the office, and then they give themselves this injection of the medication 2 times a day with a very, very tiny needle, usually with a pre-filled pen. So this one is the newest one in this category called Victoza, and each of these have their own websites if you want to look up more information about them. And Victoza is very significant with weight loss as a side effect, and it's only once a day. So that is an important progress forward. Another good thing about Victoza compared to the others in this group are that it's not going to make your blood sugar go low. You're not going to end up hypoglycemic. So it doesn't matter what time of day the injection is done. And the pre-filled pen is really easy to use. So this is an innovative, really, it's what's called an off-label use of a FDA-approved medication, and very, very effective and can be very helpful for weight loss. So another area that we have is the topic or the area of set point malfunction. And what we see is that this is really a major problem when people have the yo-yo effect, where despite their best efforts, they lose weight, it comes back. They lose weight, it comes back. It seems like the brain has a set point, And if that set point is higher than what is healthy, then a person's efforts can be really, really frustrated. So the set point is in an area of the brain called the hypothalamus, and there's a genetic influence as well. And the set point can actually be raised by doing aggressive or yo-yo or chronic dieting, certain medications, certain antidepressants, certain seizure medicines, other insulin-secreting medications can result in this, chronic illnesses like chronic fatigue syndrome, fibromyalgia, and as you see in quotes, the natural effect of aging, so that probably has to do with the decline in the hormone levels that we were talking about earlier. So what can we do about this? So there's lots of solutions to help with the set point adjustment. Many times we diagnose suboptimal thyroid function, we replace the thyroid hormones, and we get thyroid optimization, which results in a very nice, quick onset of an effect on bringing about some weight loss. Consistency in diet and activity levels, so not going through fads or the latest diet of the week, or going out and doing some crazy level of activity that your body is not used to. It's really, my hat is off to any of you out there who have done marathons or who want to do marathons. However, if someone hasn't been doing that on a regular basis and just decides to go do that as a weight loss effort, it's very sad. I hate seeing that backfire, and I've seen that many times. So also, we also want to aggressively manage conditions that have been told, a lot of patients have been told by the doctors there's nothing that can be done. Well, luckily there's all sorts of things that can be done for chronic fatigue, fibromyalgia, chronic infections, and other chronic inflammatory states. We're going to talk a little bit about naltrexone in a moment. Actually, we can go ahead and go there. So naltrexone is a really interesting medication. It was invented, it is an opioid receptor blocker, and it was invented to be used in narcotic addiction and overdose managing. And however, that's what we've now found is that in low doses, about 10% of that dose actually modulates the immune system and helps with a very big variety of conditions, especially with autoimmune conditions. So we do a little bit higher dose than the immune modulating to help with weight loss, and it can help with the set point adjustment. This is a study showing a combination of naltrexone with Wellbutrin. Wellbutrin is an antidepressant that is actually activating to the central nervous system, and people feel a little bit more energy very typically. Not everybody, but in some people, this is the thing that makes the magic difference. This combination can really be a really wonderful surprise for people who have been stuck for a long time regarding their weight. So this is showing placebo at the top versus the study combination of Wellbutrin and naltrexone. Another medication is serotonin. Serotonin is a brain hormone, and it's actually also released to a great extent by the gut. So when the gastrointestinal system is not working, the serotonin production is decreased, and so we can actually replace serotonin. And this was a study that was very well conducted, double-blind, controlled study, and patients compared to placebo lost about a half a pound a week. They had less cravings, lower appetite, and it can also work synergistically with other medications. And it's also been tested out at much higher doses, and no bad effects were found from the study. And this was from data reviewed in over 7,000 patients. This is a very big study looking at this. And of course, it's nice to have the side effects of improved mood and energy, less headaches, anxiety, again, just generally feeling better. And as I said, no significant adverse effects with this medication. Why do we get food cravings? So we'll talk about it briefly in a little bit, but really one of my favorite things to tell people is that there's a great degree to which it is not people's fault when they have food cravings. They feel, we do a blame the victim, and people blame themselves, and they feel weak and not enough willpower. But in fact, there are a lot of physiologic reasons for having food cravings. So depression can be a cause of this. Low serotonin can result in food cravings. Insulin resistance, leptin resistance. The cells of our body think we're starving, so they demand more food. There's also the psychology of food. We pop out of the womb, and the first thing we want to make sure that a baby can do is eat. Is he eating? Is she eating? Is she gaining weight? That's the very first thing we pay attention to. So I think it's no wonder that we have a lot of psychology around food, a lot of cultural influences on food, and then we also have a vicious cycle around the issue of yeast. There's normally yeast in the intestinal tract. However, if your gut is not working well, if you have anything going on, any degree of constipation, diarrhea, anything like that, there could be a dysbiosis, an imbalance in the organisms that should be there. And if there's an overgrowth of yeast, then it's going to result in craving sugar in particular. Okay, another tool is HCG. HCG is the pregnancy hormone. It stands for human chorionic gonadotropin. And HCG has been around as a weight loss tool since the 1950s. And it has come and gone in popularity, and it is enjoying a current surge in popularity, so it's likely that many of you have heard of it. It's out there in the form of drops as well as injectable. We think that in our discussions with the Holtorf Medical Group doctors and our review of the scientific data is that the studies really show the effectiveness of the injections. It seems to be too big of a molecule to be very effective and to be able to get in through the mucosa of the mouth. However, it is out there in both forms. We use it only in injectable form because we feel that is really how it's the most effective. Suppresses appetite, directs fat metabolism. It directs the metabolism to burn the fat preferentially. Now, if you look on the internet, you'll find a 500-calorie diet as an HCG diet, and we definitely think that is too low. That's too restrictive. If people aren't doing other hormone balancing, they are most likely going to end up in that reverse T3 problem that we talked about. And so it needs to be a reasonably low-calorie eating program, not the 500-calorie diet that is out there as the HCG diet. And it's a once-a-day injection. Again, we dispense the supplies from our centers and teach our patients how to inject, and it's very effective for many, many people. Another tool that we have are our Lipobe injections. They actually do look pretty similar to the picture that I have here, but not this size of a needle. It's a smaller needle to do the injection. The solution consists of 2 different vitamins, 3 different amino acids, and of course they're in high doses. Anytime you inject something, you're going to get a higher blood level, a tissue level, and it helps with fat metabolism and transport. And this one is, again, we dispense it from our centers. We teach you how to inject it, and it's twice a week. And again, it has to be in combination with lifestyle change. It's not going to work in the face of the standard American diet of fast food and those types of things. So there has to be lifestyle adjustments as well. I think this is the last of the medications. We're going to switch gears in a moment. So human growth hormone is generally as an injected medication. However, we do have a supplement that stimulates your body to make more growth hormone. So growth hormone declines as we get older. It goes down very significantly starting up after our early 20s, which is why people often say, oh, I used to be able to eat whatever I want. Now, not so much. This is one of the hormones that participates in that process. So growth hormone injections, I believe, they get a bad rap because of athletes who abuse them in about 100 times appropriate dosing. But in appropriate dosing, as a daily injection with a very tiny needle, really improves body composition, improves cardiac markers, insulin sensitivity, works on brain function, bone density, really helps in quite a few ways. This is a little graph showing, and this is kind of interesting. Let's look at the bottom first, where we see men using growth hormone and having a real significant decrease in body fat. However, in the women, the women required growth hormone plus hormone balancing, hormone replacement therapy to see this dramatic effect. So for men, it was with or without testosterone, they had a good effect. In women, they needed to combine the two. So that's kind of interesting. But we see a very nice effect for body composition and fat burning. So switching gears, I wanted to say a little bit about what we call nutraceuticals as opposed to pharmaceuticals. And we carry quite a few different supplements to help patients from a more natural approach, in addition to using things that are by prescription. And I just have a couple of the ones. There's actually a few other ones than what I have in this presentation tonight, but this is one of them. It's called Thyroid. It is particularly a good one in folks that have had a history of low thyroid function and Hashimoto's disease, where they have an autoimmune side to the low thyroid. So Thyroid has an active ingredient called forskolin, which is shown up here in the top of this slide, which it was studied on its own and shown to result in weight loss, and that's what this study is showing. And it's just one of the ingredients in the Thyroid. So Thyroid does thyroid support and immune modulation along with the forskolin and can be very helpful with weight loss. Gluco FX is another one of our supplements that, as you can see on here, actually brings down fasting blood sugar. We have another supplement called glucerol, but I believe I don't have a slide about that. I'll take care of that for the next time we do this class. But we have several supplements that bring down fasting blood sugar, bring down cravings, and are extremely helpful. So if we look at the bottom, we see cholesterol coming down, good cholesterol increasing, insulin resistance. So we see a lot of good metabolic effects from Gluco FX. And by the way, I just want to also say that, we're going to talk about ways that we can actually help you, whether you become one of our patients or not. I'll review that in a little bit. Another tool that we use with our patients is a program of meal replacements. For those of you who have done other types of programs and diets, meal replacements are becoming more popular, bars and shakes, that type of thing. This program in particular uses MetaFast meal replacements that have been developed over the last 30 plus years. And this is a program that has a structure to it as well. And most studies, as well as most fitness trainers articles that you read, will now say that portion-controlled meal replacements are very effective in helping lose weight because you can eat small amounts throughout the day and keep the metabolism going so that the body will burn fat. This program also has, notice I'm calling it a program and not a diet because it has a structure so that the first phase is the weight loss, the second phase is transitioning off of that, and the third phase is maintaining. Okay, so this is a program I've had experience with my patients. I learned about it at a hormone meeting, and I've been using it with patients for almost 4 years, as well as with myself. So let's see. So what we do here at Holtorf Medical Group is very thorough. The lab assessment is very, very thorough. We do standard tests with blood work as well as some non-standard tests. checking the leptin level, checking the serotonin level. Those are not standard types of tests that are usually ordered or that doctors are familiar with even to order them. We do tissue thyroid testing in the office. Very interesting way of checking the conversion to the thyroid hormone, the active hormone, in the level of the muscles in your bodies. And we can do also in the office measure your basal metabolic rate, which can be very illuminating as to what has been happening and why it's been such a challenge for you related to your weight. So what we have, as I mentioned a little while ago, the prescription medications, if we're going to do hormone balancing, we will, in the vast majority of cases, always keep it bioidentical hormone replacement. And what we're trying to do is get at the underlying cause of what's happening and not just treating the symptoms, which is the usual pharmaceutical approach. And also supplements, as I mentioned, we call it the Nutraceuticals. And also nutritional support, gastrointestinal support. A lot of times we can clear up the yeast overgrowth. We can use prescription as well as supplements to assist the healing of the lining of the intestinal tract. And that is really, really important for long-term success, reaching a healthy weight and staying there. So we want to reverse the trend, and here we go. Here I have it animated, so it's showing this getting, as we said at the beginning of the presentation, that if I were able to keep going with having the states show up, it would just get redder and redder as we come up to the current 2012. In fact, I read a study just yesterday showing that obesity rates have not changed. This is in adults and children, and it was comparing to the first decade from 1999 up to 2008, and then they compared to the last 2 years, and obesity rates are not doing any decline despite our best efforts. So we want to reverse this trend. So I'm showing you in the whole country, but why is it important for you in particular? And these are things you probably already know, but a lot of times people really don't realize the health impact of carrying around the extra weight, in addition to the fact that it's hard work to carry around that extra weight. We have cardiovascular disease, abnormal lipids, cholesterol, etc., diabetes, of course, stroke, high blood pressure. Quite a few different types of cancer are increased in the setting of excess weight. Of course, arthritis will be worse. Again, cause and effect. It's like a chicken and egg where you're carrying the extra weight and can be really painful to the joints. Sleep apnea. At least half of all sleep apnea is due to extra weight, and it can respond to relatively minimal weight loss. Sleep apnea can get better pretty quickly, as well as mood changes and depression, which often will have to do with the hormone imbalances that go along with overweight and obesity. And it's not personal. You know, I have a little CD that I give to people sometimes called "It's Not Your Fault." We're surrounded by stress. The food industry does not help. The marketers are all over us. They've got it figured out. If you thought that, if you read that thing a few years back, okay, let's do our shopping around the side of the grocery store where the fruits and vegetables and meats and dairy are, well, you know, the marketers are onto us. They've got the strawberry glaze right next to the fresh strawberries and the little shortcakes. You know, they know what they're doing. Unhealthy food tends to be less expensive and easier to get a hold of. Portion sizes, you know, I have lots to say about that, but I definitely want to make sure we have time for questions. But again, no doubt this has been shown in studies. Two things. One is that portion sizes have increased dramatically over the last few decades. And if you have a larger serving in front of you, you will eat more. If you have food on a larger plate and it's more full, you will eat more. That's been shown in studies where they served certain size portions and watched how much people ate. If the plate was bigger, they ate more. If the glass was bigger, they ate more or had more of the smoothie or the shake or something like that. Technology has made life easier and easier for us in some ways, at least as far as expending energy. And, we used to have to go out and grow our food and hunt for our food, and now all we got to do is drive up through the drive-through, and we used to even have to roll down the window with a thing. For those of you that remember rolling down a window, now you just press a button. So really, about 2 calories spent for a meal that can have thousands of calories. And it's becoming a public policy situation as well. People feel, well, there's nothing I can do because the situation has just gotten so out of control. But we have lots of ways, and here are our smiling faces again. We have lots of ways to help, and various centers around the country, hopefully more and more centers going forward, and we are really looking forward to being able to help you. So if you come to see us in one of our offices, we like to have people come at least once a year in person, and we can do follow-ups on the phone in between as well as Skype. We have several patients internationally. We see them via Skype, and we do everything we can to help you get labs covered under your insurance and everything else to assist you with that process. Now, also, we have a new program that I'm very excited about, which is a phone consultation program in which you fill in our extensive and very thorough questionnaire, which is the health assessment, and we schedule the time. We can order labs, we can review labs that you've had done, and we can make treatment recommendations. So we stop short of prescribing to you if you're not officially one of our patients. However, I'm very, very excited about this. It's very effective. As you can see, we're here together on the phone, and I really enjoy doing phone consultations and phone appointments as well, especially when we can involve the computer, because the holtorfmed.com site has hundreds of handouts, informational pieces that you can use to learn more about all those things that we've been talking about. So to pursue it, this is the toll-free number that I have on the slide. I'll leave the slide up while we take questions. And I want to thank everybody very, very much for taking time out of what I know is a very busy schedule. We are all busy nowadays. And I'm excited that we'll have this up on the website for people to listen to. So if you know anyone who was not able to be with us tonight who wants to listen to it, they'll be able to go to holtorfmed.com to locate the link to that. So thank you so much, and I wish everyone the very best, and I'm going to take some questions for the next few minutes.
We have lots of questions for you, Dr. Lyster.
Fantastic.
Okay, let's start off with, Stephanie would like to know, what role does serotonin play in weight loss?
Serotonin, as I mentioned, is a brain hormone, as well as the fact that it is released from the intestines and affects a lot of areas on the body. So it has a role with mood, and also it has a role with what we talked about, the set point in the brain. The way we feel about things does affect us physiologically, as well as our thoughts and our actions. And serotonin is one of the chemicals that mediates that.
Excellent. And then we have a question about what medications or supplements do you find appropriate for stress or compulsive eating?
Okay, well, that's a really big question. That's an excellent question. And I would say that that's the sort of thing that really takes a lot of time to answer and very personalized to various people. So for one, it would depend on how it's manifested. If someone is not sleeping well, then sleep is very important to address, very important to weight loss. Other ways of reducing stress are always going to be helpful and are a very important part of what we call, the lifestyle changes we want to make for sustained success in the area of being healthy. We like to do a more supplement, natural approach as opposed to sedatives and other pharmaceutical ways of treating the symptom, we prefer to use things like L-theanine, other adrenal support that can be, we have one called Adrenal Calm. So we like to approach it from the supplement side very often. Sometimes serotonin can help with mood. So that's a big, big question with lots of answers.
Okay, Stephen would like to know if a no-sugar, low-carb diets like paleo are good for the long term.
Definitely. The paleo, so for those of anyone that hasn't heard that term, kind of the paleo diet is the new way it's being referred to. So if you think back thousands of years ago, before we were growing crops of wheat to make into bread, before we were making alcohol, we were eating lean proteins. We were catching animals and eating that lean protein, and we were, of course we do that, eating meat now as well, but at that point we were limited to lean proteins and fruits and vegetables, things that grew out of the ground or fell off a tree. And so that's what my understanding is of when we talk about the paleo diet, and it's absolutely useful in the long term. The closer we can get to that, the more healthy we tend to be and the better we tend to feel. Our bodies are designed, our bodies are not physiologically, biologically designed to process all the wheat and the alcohol and chocolate, all those good things in life that we invented. Our bodies are not necessarily designed to metabolize those efficiently. That's a great question.
Okay, great. All right, and Elizabeth would like to know how you treat the dysbiosis with yeast overgrowth in the context of a weight loss program.
Yes. Okay, fantastic. So again, depending on the severity, depends on the individual situation, what's happening. We can tell with the history and talking to people, and if you're here with us in the office with the physical exam, when people have yeast overgrowth limited to the gut, or if it's really systemic, if people have toenail or fingernail infections, rashes, that kind of thing can reflect yeast spread throughout the body. So depending on which it is, we use a different antifungal treatment, which is a prescription, in combination with supplements, including a powder. One in particular, very effective, is called Gut Feeling Max. Any of the supplements that I've mentioned during this whole discussion, you can read about through the link on the holtorfmed.com. It'll take you over to the supplement site, and you can see a lot of good information. So Gut Feeling Max has high doses of various ingredients that are healing to the intestinal lining. Other supplements that are good for the long term that help with sugar cravings include the Gluco FX. Another one is called Candinex. So we approach it from all of those angles.
Okay, great. We have Athena, who has been on HGC but as a athlete, and is wondering what diet would be reasonable for an athlete is on HCG and also having trouble losing any more weight.
Right. Well, that's also a good question. So again, it's a challenging question because the going wisdom is that if you exercise more, you'll lose weight, right? So people who have trouble with their weight are usually blamed or told they're lying about what they're eating or exercising. But unfortunately, it's actually that our bodies interpret intense exercise as physiologic stress. It can actually lead to the reverse T3 problem that we talked about. So this is a tricky thing. Let's see if I can give a simple answer for right now. So HCG can be helpful. A lot of these other tools that we talked about can be helpful. However, in a lot of cases, when someone is exercising intensely, the body will just continue to interpret that as a stress, will slow down the metabolism and just hang on to that weight. So sometimes, a lot of times I have trouble convincing patients of this, but a lot of times actually lowering the intensity of the exercise can actually result in better weight loss.
Excellent. Okay,
my marathon runners don't like to hear that.
Okay, we have one. It's a lady who's had ovarian cancer and a hysterectomy with BSO in 2004. And a year and a half later has suffered with debilitating fatigue and diagnosed with chronic fatigue syndrome and has gained a lot of weight and cannot exercise. Can you give me recommendations? And she has not taken any HRT.
Okay. Right. Well, not only has she not had, have you not had HRT, but that's a whole reason why it's important to have a doctor knowledgeable about, medical conditions as well as all these different tools and how they go together. So I'm sure that most doctors would not want you on any kind of HRT. So again, it's a question of doing a detailed history and physical, and if you're not already our patient, maybe that phone consultation program would be a good way to go, because it's really, I think, going to be very individual. It's a question of looking at your lab work. Do you have leptin resistance? What kinds of medications are you taking? There's a lot of information to put together, but I'm pretty confident that we'd be able to come up with something. And again, for exercise, moderation is the key. We're going for long-term sustainable success here, and an extra, more intense exercise doesn't achieve better results. Sometimes it actually makes things worse. So nice and easy in that area. So it would be a combination of things.
Okay, we have a question, and how do you start to lose weight when your thyroid is not normal?
Well, we often will start with correcting the thyroid hormone levels, and that is probably the number one. It's definitely in the top few things that we address, and we want to bring things into optimal. So I really appreciate the question, because a lot of people, even before, a few years ago, before I knew all this information, I would also just check a TSH and tell people, oh, it's fine, sorry, it's not your thyroid. But now, of course, we've learned a whole lot more about that. And so that, I think, would be the central place to start, especially because lowering calorie intake, it can achieve weight loss as long as we don't end up with the reverse T3 problem. So if we're managing the thyroid first, then we can use other tools successfully. So thyroid is, I would definitely say, the first place to start. There could also be an immune component. If there's an immune component involved in that, then we would address that at the same time. One or two more questions, maybe?
Yeah, we have. I think we can do one or two more, and we still have a couple. You had lots of good questions tonight.
I'll bet we have tons of questions. And why don't we have people? We'll figure out a way to look over all the questions, even if we can't stay on the line too much longer. I don't want to keep everybody too late. But let's take one or two more now, and then we'll review all the other questions and maybe put out some type of newsletter with the Holtorf newsletter with more question and answer, or maybe post them somewhere. We'll figure that out. But go ahead and let's do a couple more.
Okay. Someone wanted to know if you had a thought on, they had been prescribed Victoza and metformin, but heard that there was a possibility of getting thyroid cancer as a side effect of Victoza. Did you have any thoughts on that?
Indeed. That's only been shown in the laboratory animals, and there are no human cases of it at this point. And it's an extremely unusual type of, it's a very particular, it's not the usual type of thyroid cancer even that most people get. And it was produced in the laboratory animals with exceedingly high doses, much higher than humans receive. So at this point in time, it is definitely on the consent process, but it's not considered a clinical problem. It has not been seen in anybody yet using Victoza. So it's relatively new on the scene, but of course that means it's been studied for quite a few years leading up to the release to the general medical public.
Okay, and this might be an office question, but I'll go ahead and maybe you have some information on it, Dr. Lyster. Someone would like to know if insurance pays for serotonin, if it works, and how does it work if you're on antidepressants like Prozac?
That's an excellent question. So what I often see in patients who are on various antidepressants is I measure the serotonin level, and it's extremely low. Sometimes it can't even be measured in the bloodstream. And, this is also an interesting question because it's in the central nervous system, which doesn't cross over with the bloodstream. But what we see is that it's not pharmaceutically made. It's a natural hormone. So we have it available from our offices. We dispense it to patients directly from the offices, and that tends to be the best way to do that. So I'm not sure about the insurance coverage. That's a really good question. So I'm not aware up until this point that insurances have reimbursed patients for the serotonin itself. It's not terribly expensive as these things go, but that's that part of the question. And so if someone is on a serotonin reuptake inhibitor and they don't have serotonin in their bodies, this is often the situation where people say, I'm on an antidepressant and it worked at first, but now it doesn't work anymore, or they go on something like that and it's not effective for them. A lot of times we uncover the reason why by checking the serotonin level and find it to be really, really low.
Okay, how about one last question?
Okay.
Okay, great. We have a listener who would like to know what types of immune problems or inflammation disorders can affect weight loss. I am testing positive for a lot of inflammation markers and do not know why.
Great. Excellent. Okay. So there are a lot of influences, okay? There are genetic influences. There are environmental influences, what we call endocrine disruptors. We're learning more about this, and you may hear about this in the media, influence of plastics and heating things in plastics and released into the food that we eat and the water and drinks that we drink. Stress, of course, kicks up inflammatory processes. Also coagulation disorders. There's a video on the holtorfmed.com site where Dr. Holtorf is talking about it. It's a video on unique etiologies of fatigue. However, those etiologies also apply to weight that won't go away with weight loss efforts. So there can be abnormality in the clotting system that can interfere with oxygen and nutrient exchange in and out of the cells, and that can affect the ability of people to succeed with weight loss efforts. So lots and lots of influences. Dr. Holtorf has a diagram called the cycle of dysfunction in chronic fatigue syndrome and fibromyalgia in particular, but I use it with all these kinds of scenarios, including difficult weight loss situations. And it's arrows going in every direction. Is the person sleeping well? Are their hormones balanced? Is their thyroid working? Are they exposed to toxins in their environment, as well as the endocrine disruptors we were talking about? So that's a very, what we call a multifactorial situation, but it definitely sounds if there's autoimmune situation going on, the naltrexone is an extremely useful tool in that scenario, and as we showed, can be helpful also with the weight loss.
Well, Dr. Lyster, we want to thank you very much for all your expertise on weight loss and the hormones. I know everyone enjoyed it, and they had lots of good questions for you. Thank you very much.
Great, fantastic. Thank you for hosting and moderating, and thanks to everybody who joined us. And please email us with any additional questions or call the number, and we look forward to meeting you. Thanks so much.
Good night.
Good night. Thank you.